What if the most painful moments with your parent, the arguments, the confusion, the moments they look at you like a stranger, were not inevitable? What if nobody told you that the way most families talk to a loved one with Alzheimer's is the exact opposite of what dementia care research recommends? There are 6 communication techniques, validated by dementia care specialists, that most families never learn. Not because they don't care enough, but because nobody teaches them. And the cost of not knowing them is measured in distress, in agitation, in a parent who reaches for their coat and screams that they want to go home, even when they are home. I am going to show you all 6 techniques in this video. And the 6th one, the one I'm saving for last, is the most counterintuitive thing you will hear. Most people push back on it at first, and then it changes everything. Stay with me. You have probably had the conversation that went completely wrong. You gently corrected your parent. You told them that their friend passed away years ago, or that they already ate breakfast, or that this is their home, they live here now. And instead of relief, what you got was panic, or anger, or a grief so raw it seemed brand new, even though you have had this conversation 30 times. That moment is not your failure. It is a consequence of nobody telling you how Alzheimer's changes the way a person experiences reality, and how a different approach can transform those moments completely. As someone who has studied dementia care research and communication science extensively, I want to give you something most caregiver resources don't: 6 specific, research-backed techniques you can use today. By the end of this video, you will understand why correcting a person with Alzheimer's almost always backfires, what validation therapy is and why it works, and how to navigate the 6 most difficult communication scenarios caregivers face. Stay until the end, because technique 6, the one about letting them live in their reality, is the most powerful shift you can make, and the science behind why it works will surprise you. Technique 1. Never correct. Redirect. When your parent tells you their mother is coming to visit, and their mother has been gone for 40 years, every instinct says, tell them the truth. Do not. The Alzheimer's Association has been clear on this for years. Correcting a person with dementia does not help them access reality. It simply causes acute emotional distress in a person who cannot retain the correction anyway. Think of it this way. Imagine waking up every day with no memory of yesterday. Every correction is a fresh wound. You feel the grief, you feel the confusion, and then it is gone. And tomorrow, you wake up and feel it again. Instead, redirect. Say something like, your mum sounds wonderful, tell me about her. You enter their reality for a moment, then gently guide toward a calmer subject. No correction, no distress, no argument that leaves you both depleted. Here is a statistic that reframes everything. Clinical research in person-centered dementia care shows that simply not correcting a person with Alzheimer's can reduce episode agitation by up to 60%. 60%. Without medication, without intervention. Just by changing one word pattern. Technique 2. Speak slowly. Use short sentences. Leave space. Alzheimer's progressively slows the brain's ability to process language. A sentence that takes you 2 seconds to form can take your parent 15 seconds to process. Most caregivers speak at normal speed, ask a question, and then, when no answer comes, ask again, or rephrase, or fill the silence. Speak slowly. Use sentences of 6 words or fewer when possible. Ask 1 question at a time, never 2, and then wait. 10 seconds of silence is not failure. It is processing. Research from the Journal of Alzheimer's Disease found that simplified speech, shorter sentences, slower pace, lower pitch, significantly improved comprehension and reduced frustration in mid to late stage Alzheimer's patients. Technique 3. Speak to the emotion, not the memory. When your parent is distressed, when they are asking to go home, or calling for someone who is gone, or insisting something is wrong, they are communicating an emotion, not a fact. The phrase, I want to go home, almost never means the house they are physically in. It means, I feel unsafe. I feel lost. I feel like I do not belong here. Respond to the feeling, not the statement. Say something like, you want to feel at home, I hear that. Let's sit down together, and I'll make you some tea. You are acknowledging the emotional truth without arguing about the literal one. This is the foundation of validation therapy, developed by social worker Naomi Feil and now widely used in dementia care. It has been shown in clinical studies to significantly reduce agitation, depression, and social withdrawal. We are halfway through, and we have not yet reached the technique most caregivers find hardest, but most transformative. Stay with me. Technique 4. Use their name. Use yours. Use touch. As Alzheimer's progresses, faces become harder to recognize. Even familiar ones. Even yours. Beginning every interaction by saying your name removes the invisible pressure of recognition. Say something like, "Hi Mum, it's Sarah, I'm here." Those 5 words eliminate a moment of panic your parent may have been experiencing silently. Every time you walked in, research consistently shows that familiar touch, a hand held, a shoulder gently held, activates emotional memory, even when episodic memory has failed. The body remembers what the mind cannot access. Use their name often and naturally. It anchors them. It communicates. You are seen, you are known, you are safe. Technique 5. Ask closed questions, not open ones. The question, "What would you like for lunch?" seems kind. For a person with advanced Alzheimer's, it is a cognitive mountain. Choosing between infinite options requires working memory, decision-making, and language retrieval. 3 things that Alzheimer's progressively destroys. Replace every open question with a closed one. Not, "What would you like?" but "Would you like soup or a sandwich?" Not, "How are you feeling?" but "Are you warm enough?" Closed questions offer the gift of agency, without the burden of retrieval. Your parent gets to say yes or no. They get to choose. And that choice, that small act of autonomy, is protective for dignity and for mood. Here is what most families experience before they learn this. Exhausting loops of repeated questions, increasing frustration on both sides, and eventually a parent who stops responding because answering has become too hard. Closed questions break that loop entirely. Technique 6. Enter their reality. Completely. This is the one most people resist, and then never go back from. If your parent believes it is 1987, and they need to pick the children up from school, and the children are now adults in their 40s, do not correct them. Enter the reality with them. Say something like, "The children are taken care of, they are safe, you don't need to worry." Not, "We are all grown up, that was 40 years ago." The first response creates calm. The second creates grief, acute, real, felt grief, for a reality your parent is experiencing as new. Dementia care researchers call this therapeutic fibbing. And while it challenges our instinct for truth-telling, the ethical framework is clear. When the truth causes harm and creates no benefit, compassion takes precedence. Person-centered care research, published in multiple peer-reviewed journals, confirms that caregivers who consistently enter the patient's reality report lower caregiver burden, fewer agitation episodes, and better quality of life on both sides of the relationship. You are carrying something enormous. The grief of losing someone who is still here. The exhaustion of caregiving. The guilt of every moment you got it wrong. I want you to hear this clearly. Getting it wrong is not evidence of not loving them enough. It is evidence of not having been given the right tools. Until now, here is what happens when you begin applying these 6 techniques, even imperfectly, even inconsistently. Apply techniques 1 and 3 together. Redirect and validate. The next time your parent says something that is not true, do not pause to think about whether to correct them. Ask yourself one question: what emotion is underneath this? Then respond to that. For example, if they say, "I miss my mum," hear the longing. Say, "She must have been very important to you. Tell me about her." You are not agreeing with a false belief. You are acknowledging a real feeling. Use the closed question rule for 1 full day. Tomorrow, make 1 commitment. Every question you ask will be closed. Soup or sandwich? Green shirt or blue? Walk now or in 10 minutes? Watch what changes in the quality of interaction when decision fatigue is removed. Say your name every time you enter the room. Starting today, every time, without exception. It takes 3 seconds and removes a potential moment of silent panic your parent may have been experiencing every single time someone walked through the door. I know this is hard. Not the techniques. Those you can learn. The hard part is accepting that the relationship has changed. That the parent who knew everything about you may now need you to introduce yourself. That grief is real and valid, and you do not have to pretend otherwise. But inside that grief is also this. Every time you apply these techniques, You are giving your parent moments of calm, of dignity, of being seen, in a disease that can feel like it is erasing them. That matters immeasurably. If this video gave you something useful, subscribe to Fogbreaker. I release practical, compassionate content for dementia caregivers and brain health every Wednesday. 3 things to take with you. 1. Correcting a person with Alzheimer's does not help them. It causes fresh distress in a mind that cannot retain the correction. Redirect instead. 2. Speak to the emotion, not the memory. When your parent says something untrue, the feeling underneath it is always real and always deserves a response. 3. Entering their reality is not deception. It is the most compassionate thing you can do for someone whose reality you cannot bring them back from. You are doing one of the hardest things a human being can do, caring for the person who once cared for you, while watching them change. You deserve tools that actually work. And now you have 6 of them. Which of these 6 techniques do you most wish someone had told you sooner? Drop it in the comments. I read every single one. You are not alone in this. Keep going.